use block scheduling. Use blocks. Block scheduling simply means you put blocks of time in your schedule with the idea of reserving that time for certain procedures. I'm going to suggest that every one of our listeners have two types of blocks. They can be different color coded, by the way. One block would be what we call rock blocks. Rock is simply an analogy to refer to larger production. Now, every practice will have different types of rocks depending on what your mix of services are. It could be a single unit crown. It could be multiple units of crown. Now, could fillings fit in a rock block? And my answer to that is it depends how many you're doing. If you're doing a single tooth with two surfaces, that's not going to be a rock. That's relatively minor production. But if you're doing a quadrant of direct composite fillings, that could be a rock. Oral surgery could be a rock. Endodontic therapy could be a rock. Your high value services will certainly fit in the rocks. So I recommend that you have a certain number of rock blocks in your schedule every day that are reserved for the higher productive procedures. And a typical way to do that would be to have 3 rocks, in an 8-hour day, different times, different appointment time. The other type of blocks I'd like you to see in your schedule is to have new patient blocks. And what I mean by new patient block is the doctor part of the new patient appointment. And depending on what your appetite is for new patients or what your flow is for new patients, that might be 1, 2, or 3 new patient appointments per day, something like that. And the doctor part of the new patient appointment will also go in as a block. And you can't schedule anything opposite of that because of the fact the doctor can't be in 2 places at once. By the way, if any of you figure out how to be in 2 places at once, please send me a text message. Let me know how you're doing that, because I would like to learn that myself, how to be in 2 places at once. But now those are the rocks, and those are the blocks. Now, I'm teaching my clients to go completely through the end of the year, end of 2023, with those blocks already in place in your schedule. And if you want to be really bold about it, go through your calendar in 2024 and put all of those blocks in your schedule. Now, they won't have any appointments attached to them, but you're reserving your time by scheduling those type of blocks in your appointment. Now, I'm going to recommend that you use a 48-hour release of any block. In other words, if you can't schedule it ideally with the types of procedures that go into those blocks, then release it and schedule anything. But don't do that until 2 days ahead. By having that flexibility, you can accommodate new patients. You can accommodate urgency when someone wants to get something done that involves, higher production. You have the ability to accommodate that patient. So the idea of using the blocks, but also using the 48-hour release is a very important, granular detail in terms of engineering your schedule.